The Ebola virus has been spreading death in several populations of West Africa. Liberia, Sierra Leone and Guinea have had a total of more than 3,000 deaths confirmed or suspected to be from Ebola. Overall, more than 6,000 people are believed to have been infected in the biggest outbreak of the disease in history. The Times' Johannesburg Bureau Chief Robyn Dixon is in Liberia and joins us to give an update on the situation there. Hello, Robyn.
Hello, Anne.
So, Robyn, bring us up to speed. Where do things stand with regards to the outbreak, specifically in Liberia? What are the numbers?
Well, this is really a tragedy of epic proportions, and the casualties are reminiscent of a war. I've seen houses where 10 or 13 family members have died, orphans are being left with no one to care for them, shunned and rejected by their communities. And in Liberia, we've seen 1,830 deaths. It's probably an underestimation, and nearly 3,500 people infected.
And how efficient has the government been about informing the general public?
Well, Liberians really feel very betrayed and very angry with their government. And they felt that the time to act, to get out information and to take action to police or close the border was in March, when this outbreak first started in eastern Liberia. And there's really a sense of betrayal that it was allowed to get to the capital with the catastrophic results that it's had.
Talk about how people are being treated, those who are infected. How are they being treated? Where are they going?
People are being treated in isolation wards by people in heavy protective suits, full body suits. And I think it's very, very difficult for children. Often they've been through incredible trauma. They've watched their mother die, perhaps their father die as well. And some of them die alone in those wards, really, with not a human touch to console them. People in these rather alienating suits. So it really is a tragedy in many ways.
Gosh, it sounds like a horrendous situation. Is there mass pandemonium? How are people coping?
Well, and they're doing the very best that they can. And I met one grandmother who managed to care for her little grandchild who'd been left to her, a baby. She had to change the diapers, and she did so without getting infected. But I think denial is a very big problem. Another woman I met, Maureen Yentu, her son had been showing all the classic signs of Ebola, and yet she was convinced that he didn't have it. It must be something else, anything but Ebola. So she was caring for him and treating him, cleaning him up, and really putting herself very much at risk. And he then went into an Ebola treatment. She really hasn't heard from him since. She doesn't know what's going on with him at all.
And how would you describe the general state of the healthcare system in Liberia? I mean, Ebola is one thing, but obviously people are probably suffering from other illnesses. How is the healthcare system coping?
Well, even before this terrible epidemic, and people really lacked confidence in the healthcare system. If you got sick, you would go to your drugstore or to a faith healer or to a traditional healer. And if that didn't work, your last resort really would be to go to hospital. Now we've seen the complete collapse of the primary healthcare system. Many people with preventable diseases like malaria are dying, and there's a hidden toll there. We do not know how many casualties there are from that. But it's even conceivable that at the end of all this, we'll find that more people died from those preventable diseases than from Ebola itself.
Gosh, and I can't even imagine what it must be like to be a healthcare worker, a medical worker, trying to combat this disease. Have you managed to talk to any at all?
To me, Anne, they're the real heroes in this story. They really are. I met one Kenyan nurse, Patrick Gathinji, and he talked to me about that life or death moment, inserting an IV line. You really do feel that your life is on the line.
The most dangerous part of the job when working in ETU is when you are fixing an IV line and when you are taking a blood sample for the lab analysis. That's the most dangerous part, because you know if you make a small mistake, you pick yourself, you are putting yourself and your life on the line.
Gosh, Robyn, you spoke about the medical workers being the real heroes. Are they perceived as heroes by the general populace?
Well, sadly, Anne, in many cases they've been stigmatized, and I think that's kind of quite heartbreaking. There have been many cases where they've been evicted from their houses, or told not to come to their communities, and stigmatized for fighting this disease. And yet they keep on doing it. They keep on fighting because that's what they believe in, and they want to save their people. And I think that's what makes them heroes.
Well, just to wrap up, Robyn, do these medical workers feel the message is getting out there? What kind of message would they like to send to the rest of the world?
Well, all the ones that I have spoken to, Anne, had one message, which is we're doing our best. We're doing the best we can, but we can't do this alone. We need help. We need more Ebola treatment units, and we need to know who is going to staff those units and who's going to manage those units. And before those questions are answered, I think we're a long way from solving this crisis.
Yes, I have a message to the world that Ebola is a dangerous epidemic that is affecting the whole of West Africa, and we need the world to come and bring more manpower resources, medical supplies. We need community education about the Ebola thing, and we need support to the local governments working so that we can be able to fix the health systems and fix the economy so that we can be able to contain this disease.
Robyn, thank you so much for your insight.
Thank you, Anne.
For more on this story and others, please visit latimes.com and follow us on Twitter @LATimes. Also, you can follow regular updates from Robyn on her Twitter feed.